Hopefully you guys can hear me. We'll see. I am live streaming from out of town, but this is such an important topic and I wanted to come on here and chat about it. Let me turn on TikTok. Let's see. Hello, hello. Anybody out there? Let's go live on. Hello. Hello, you guys. Ashley, is it working on Instagram? Hello. I'm hoping this is working. Ashley. Hello, everyone. I am going to be talking about SA, which is assault after, of a certain type, but I can't say it on here. We're trying to get all the technical stuff going. Let's see. Okay, so I am live on Instagram. Okay, I'm just making sure it's working. Hello. Hey, you guys. So I'm going to have to be super cautious on what I am saying because you guys know some of these platforms are really difficult. And you can't say a lot. Hello, Ashley. So you guys, some of you guys know I am out of town in Kansas right now. And I'm here because Ashley, my community manager, one of our doulas in training, is pregnant. And I am going to hopefully be here for her birth. Hi, Dylan. How are you? Hello, hello. If you're hopping on, tell me who you are. Tell me how far along you are, how many weeks, what number baby, give me all the details. And just so you guys know, I am out of town, so it's a little wonky right now. If you're on TikTok watching, you can also come over to Instagram or YouTube, whichever. But I may be looking in weird directions, just so everybody knows. Let me try to make it where I'm not like looking in so many places. Let me turn this. So you may see some babies and kids running around. I am sitting right in the light. Okay, so we're going to be talking about a super, super sensitive topic. And this topic is hard to chat about as a woman, as a labor nurse, as a mom, as a victim. So I just want you guys to know you're in a safe place. This is a safe place. And this isn't medical advice. This is advice from a labor and delivery nurse and a mom of 7. My family has been profoundly and ever changed forever by the topic of SA. Some of you guys who are in my membership, in my community, who hang out with me on a weekly basis, if you don't know, we have birth classes, but we also have our mama membership and our community, which is where we have some of the most incredibly hard, sensitive, emotional conversations. And a conversation happened probably about a month and a half ago on our Mornings with Trish, which I go live in my community, and we just hang out. We have coffee, we have raspberry leaf tea, getting prepped for birth, postpartum moms, whatever. We sit and talk about some really hard conversations. And one of the conversations happened to be about abuse of this kind, this particular type of abuse. And the very first thing I want to say to you guys is that this type of abuse, SA abuse, happens everywhere to all people. Like there's like, it crosses borders, right? And the numbers are astounding. And I have been a mentor, a leader, a group leader in many groups of women. And the overwhelming majority of those women have been assaulted in some sense. Now, again, if you're just joining, there's certain words I can't use. So I'm going to say SA instead of the type that we're talking about, instead of full on saying it. But you guys know I get booted off of Meta for saying words that have to do with birth. So we're going to be really, really cautious. But I don't want to deny what it is because it's straight up wrong. And no one should ever be violated in this way. And so a couple weeks ago, we're on our hangout, our mornings with Trish, and one of my mamas, who is so precious to me, shared her story, and her story had a history of SA from a family member. And having walked through in my own family in the last few years with SA, I have been counseled and taught the importance of validating the victim, believing the victim, supporting the victim, helping them get justice, whatever they deem necessary, supporting that. Because when you deny the victim or deny the truth of what happened to them, even if it's hard to wrap your mind around, you're only causing more trauma. And so, one of the first things that I would recommend if you're a family member of someone who has experienced SA, or you are that person, knowing that needing that validation and needing to be believed is so important. And I have a list here for you guys because I'm not going to do like slides or anything, but I did want to give you guys resources. So the very first thing I would say to you is this talk is from one mom, one woman, one labor nurse to a large group of more women. Men experience SA as well. Not necessarily pregnancy and birth after that. And that brings something that is so hard to explain. My own SA experience affected my first birth because I was young and it was very close to when it had happened. So I see a lot of you guys asking me birth and labor questions. I will do another live Ask a Labor Nurse where I ask your questions, but this one we're really going to be focusing on this topic at hand, which is pregnancy and birth after SA, having experienced that type of trauma. If you don't know what SA is, go Google it real quick and you'll know, because I really can't say it on here. I can get in trouble. So the very first thing I want to say is this is not medical advice. This is my tips to you to how to navigate pregnancy and birth after this. And I am so passionate about this subject that we've actually are adding a module to the birth classes, because when we had that Mornings with Trish conversation, there were 10 of us on there, including me, 9 of my students and members. And out of 10 of us, 9 of us had experienced SA. 9 out of 10. Which that really runs in standards with how many women are abused in this way. So that's why we're talking about this today. And I just want to tell you, number one, if you've not talked to anybody, talk to someone, seek help, get therapy, tell your OB. And we're going to talk about how to navigate that with your birth plan as well. And then I have a number on here, which is the national hotline if you've experienced and you need help. So there's that as well. Okay, so the first thing we're going to talk about, let me pull up my notes because y'all know, you guys know I can't stay on topic, especially with something this sensitive, and I may end up crying, just so y'all know. This is a very sensitive nature, very sensitive topic. That's why I wanted to provide resources for support now, if you need it. So the very first thing that I would say is someone ever shares with me as a labor nurse or with the providers or with your healthcare team, this is confidential, and I pray they treat you with respect. That should be, another thing I really want to encourage you is to practice some self-care, because taking care of yourself is so valuable and you are so important. And even if your SA happened years and years ago and you think that it doesn't affect you, it might. And a lot of times when you become pregnant or you have a baby, you go through this very intimate experience. It may trigger some things that you have suppressed, because a lot of us are taught to just shut up and deal, right? Even if, like whatever variants of SA that you experienced. So I just really recommend to take care of you, get help, talk to someone, and see that, you just need to be heard. That's it. You really need to be heard, and you need to take care of yourself. So if you're new here, my name is Trish, labor and delivery nurse for over 16 years, a long time, and a mom to 7. And so I've walked through a lot of births with moms who have experienced SA. And a lot of times you can even tell if they have, whether they're telling you or not. And I think an experienced nurse that's sensitive to this is going to see some of the telltale signs. So let's talk about the emotional and physiological effects. And again, we're adding this to the course. We're going to have a module on this, navigating birth after trauma, specifically SA. So let's talk about some of the normal, and so we'll go into their more details. And you guys, if you know, the classes are open for enrollment right now. You can use the code Birth Queen to join the classes. I'm going to put the QR code up. You guys can screenshot and then come back later. Use the code Birth Queen to get $100 off. Okay, so let's go back to my notes. See, got to stay on topic. And I see some of you guys commenting. I'm so glad you're here, and I love y'all. And we're here for you in whatever way we can be. This is part of why we have our Mama membership, so that we can walk through these kind of things with you guys. Okay, so let's talk about the common emotional responses during pregnancy, because here's how it can impact your pregnancy and your birth. So many survivors of SA experienced a very heightened level of anxiety during pregnancy. Specifically, part of that comes back to the initial assault that happened to us, where we lost control of our own body, and the fear of losing control or experiencing pain can trigger anxiety attacks and constant worry during your pregnancy. So some of you guys are asking to go live with me. We're not going to do that. Yes, you can ask questions. I'm going to come and answer some of your questions more related to this topic, but I will do a live Q&A either tonight or tomorrow to tell you, Nicole. Okay, so I think it was Nicole who said, and someone said they're struggling right now. Britters, I'm here for you. You are more than welcome to reach out to us. Send us an email, info@labornursemama.com. Okay, so a lot of you guys are you may feel a heightened level of anxiety during your pregnancy because of that fear of losing control. For victims of SA, a lot of times that's what hits us hardest, because we didn't have a choice. We weren't given a choice. That was taken from you. And so during pregnancy, it's very important that we as healthcare providers and family members and partners make sure you always have the choices. And we're going to talk about what that looks like during birth. SA can also lead to PTSD, which will be characterized by flashbacks or intrusive thoughts. Intrusive thoughts are thoughts from the experience or repercussions of the experience just pop into your head like at random moments. And my family has gone through a lot of trauma in the last couple of years, and intrusive thoughts have been one of the hardest things that I've had to deal with. My daughter specifically went through something very horrible, and I just have these intrusive thoughts, not so much of what happened to her, but moments in her life where I feel like I didn't protect her. So, flashbacks, nightmares, severe anxiety, those are symptoms that can be exacerbated during your pregnancy and your birth, when your body is undergoing a lot of changes, significant changes. So again, this is why I feel like this is so crucial for us to add to our birth classes, to help you navigate those, because there's so many changes of your body, which changes in your body make you feel out of control. Feeling out of control triggers the residual PTSD from the SA, if that makes sense. Depression, feelings of sadness, hopelessness, lack of interest in maybe the baby even, or daily activities. And guess what? Your pregnancy hormones are not helping any of that at all. So that can also exacerbate the feelings of depressions and feeling out of control. Fear and panic is another sign. Fear of medical procedures, going to the doctor's office, having to get a cervical exam or physical examination or a pap smear. The whole birth process itself can freak you out and make you worried and cause panic attacks. So I know some of my students that have panic attacks during the pregnancy. It might be related to trauma. The sense of vulnerability that you might feel can also be a sign that you're dealing with the PTSD resulting from that. And that sense of vulnerability that you feel during pregnancy can trigger intense fear, especially if you're a victim of SA. The other thing that's really hard for victims of SA is that the trust issues, you may fear trusting the healthcare providers. Maybe healthcare providers were brought in for your SA experience and they didn't respect you or honor you or believe you or treat you well. So that can complicate prenatal care and labor experiences as well. And that mistrust might lead to you wanting to avoid your medical appointments or your prenatal appointments, which are really important. And maybe it will also cause you not to communicate openly with your provider. What I would recommend in that situation is to remember that your provider now is not the providers who were a part of your previous case. And if you can't trust your provider to openly communicate, you need a new one. You can fire your doctor, you can hire a new one, you can fire your labor nurse, you can get a new one who treats you more respectfully. The other thing that is hard, yeah, so someone just said, "Yeah, I feel uncomfortable with, like, them being close to me during delivery or just the help." Yeah, and that is so valid. Of course you feel that way, especially if you experienced SA because someone got close to you, got into your personal space without permission, and that's why it's really important that your healthcare team is aware and knows this is just super critical. Okay, so the impact, like we're saying, on pregnancy could be you might avoid your prenatal care, and that can lead to potential pregnancy and birth complications. So I really recommend you try to figure that out. Find a provider that you feel safe with. Maybe choose a female provider and don't see a male provider. You have a right to tell them, "I've experienced this and I do not want to see a male provider." And they need to honor that. They honor that with certain religions. So they will honor that. But remember that regular checkups are so crucial for you and for your baby. Um, the routine exams, specifically like doing a pap smear or cervical exam, can be triggering. One of the things I teach inside my birth courses is cervical exams are not that important unless you're being induced, and you can avoid them altogether. And I teach you guys how to do that inside the class, which I'm not going to go into right now, but you do have a right to refuse a cervical exam. You have a right to choose to not let anyone put their fingers inside of you during birth. It's not necessary unless you're being induced. And we have to titrate the medication. So that's a little different. Again, you guys, I want to answer your questions, but I'm trying to stay on topic, and I am definitely ADHD. So, um, labor and delivery challenges could be that the emotional and physical demand of labor, the intensity might cause you to have some flashbacks or panic attacks during birth. So this is part of reason why you need to, we actually, this launch, we offered as a bonus our birthing waves, which are guided meditations. And I'm doing one specifically about SA, and it's going to be available for sale later, very low price. It's really beautiful. But being able to control your breath, free your mind, escape. The whole point of labor and dealing with labor pain is achieving escape. And also the triggers and these flashbacks, you may need to do that. The other thing is, and I teach this in the classes, that anxiety causes adrenaline. Adrenaline is like against oxytocin. Well, oxytocin is our love hormone. That's what makes you feel calmer. That's what makes your labor flow. So we do have to come up with a plan before you walk into your labor room if you've experienced SA specifically or any kind of PTSD, so that we can keep your mindset in the right place, because that will help your labor flow. And part of that is planning. Part of that is walking through your triggers now and creating your birth narrative, being in control. What can you control during your birth? You can control who's in your room. You can. You can control whether or not males come in your room if you don't want males to come in your room. You can control who puts their hands on you. You have a lot more control than you probably think that you have. And so the things we can control, those physical choices, those intervention choices, those things we can control. We can't control so much the birth process, but we can control what the people in the room do. We can control what is done to us. You have every right of that. And so being able to walk through that prior to the baby coming is so critical, and prior to labor starting. And that's one thing. This is, again, why I am putting that in the birth course. One of the things that I did was get certified as a trauma-informed healthcare provider. I have not finished my certification, but I've done most of it. Because your nurse, and you can even ask and put on your birth plan that you would like to have a trauma-informed healthcare provider, because they understand the impact of SA and they can provide you compassionate, respectful care, because that is crucial for you. And then having a support system, build a strong, solid support system. Your friends, your partners, have a doula, make sure she's aware of what is going on, because they can provide emotional support and advocate for you during your medical appointments and during your birth. The next thing would be to create a birth plan that includes trauma-informed preferences. We're actually doing a low-cost birth plan masterclass that's going to include a visual birth plan. I'm going to teach you how to put your birth plan together, and we're going to have a birth plan template for you guys. It does cost, it's $27 because it's going to include, we hired an artist to design the visual birth plan. It's gorgeous. I think it's $19.97 is the class. We haven't listed it yet. We're doing one next week and then one the following week. So if you join the birth classes and you earned that bonus, you'll get to come for free. If you're a student, you get $10 off. So you can come for $9.97, which covers the cost of the birth plan template. For everyone else, it's $19.97. And we are just so excited. I'm going to walk through that, and I'm going to talk about how to create your birth plan, which communicates clearly to the providers if you've experienced SA. It's very important. And again, I'm just going to go back to this before we get off here, that you have to have professional support. You have to, do not negate that. And I know from a family who has experienced a lot of trauma, including SA, getting support can be very expensive, but there are resources. Do not exhaust your resources. I'm sure your community has some free resources, because you need to have some coping strategies. This is what we do with our birth class students and our members, is we teach them coping strategies. I am very, very, very passionate about mindset strategies, especially for birth, life, postpartum. And so it's really heavily embedded in my birth classes. Again, the birth classes are $100 off right now. You can use the code BIRTHQUEEN to join. Go to labornursemama.com/calm, CALM, and use the code BIRTHQUEEN, and you'll get $100 off. And then self-care practices. I'm going to end with that. You guys need to be taking care of yourself. Meditation, gentle exercising, journaling can help manage the stress and the anxiety. Practicing some grounding techniques can also be beneficial during labor and delivery. Just reminding yourself, like closing your eyes. You can put on my Birthing Waves meditation, because I do some grounding in it. Close your eyes and just say, okay, whatever your name, let's say your name is, we've got, I think, Jade over here. Say you're Jade. You can say, okay, Jade, you're in the labor bed. I can feel the bed. I can feel my chest. I can feel the baby moving. Ground yourself. I smell the hospital room. Hopefully it smells good. I hear the beeping of my IV. I hear my partner talking. Like, ground yourself through all your senses. Walk through, what do I taste? Take a drink of your drink. What do I smell? And ground yourself and remind yourself, I am not there where where the SA happened. I'm safe. I'm in control. I have rights. I'm peaceful. And do your breathing exercises. Just remind yourself where you are. All right, let me jump over here and see if I have any questions. I'm going to start on Instagram. See if anybody, I don't think anybody did, because I think I kind of told y'all that we were going to just be talking through it. I know I have a couple. Let's go here. So Ari said she feels uncomfortable with the providers and the staff being in close and like during delivery. That's very common, and you can voice that to them. If you have to have cervical exams, when I know a patient has experienced SA and they're having a cervical exam, I will usually, I always ask for permission, but we'll talk through what they want that to look like, and I go very slow. Someone said, I haven't had my period since April, but every pregnancy test I'm taking is negative. Probably negative, but you probably should get that checked out. Something else might be going on, but you can have a false negative. It's very less likely to have a false positive. 32 weeks pregnant, can I start drinking raspberry leaf tea? Yes, you can start drinking 1 cup a day now. At 37 weeks, 2 cups a day. and at 38 weeks, 3 cups a day. If you go to Instagram and you comment hashtag third on any post, make sure you're following me, hashtag third on any post, any live, anything, including if you're watching right now, you'll get my 3rd trimester labor prep pack, which I talk about the things you can do and when you can do them. How can I help myself dilated besides the raspberry leaf tea? Don't want to get induced again. So raspberry leaf tea actually will not dilate you. It only preps your uterus. It's a uterine tonic. So there's some things we recommend starting at 38 weeks that you can do that I teach in the birth class. I can't say everything in public, but we teach some stuff in the birth classes. We go into detail and we meet with our mamas every Wednesday to really break that down. But you can grab that 3rd trimester guide. I also have a free induction. I have a paid induction class, labornursemama.com/induction-class. And you can grab that for $27, and it does self-induction methods in there as well. But they're more effective if you're after 40 weeks, just so all of you guys know that. Again, the classes are open. You can get $100 off. They closed Friday night. They were supposed to close last night, but because look, you guys, there's a birth tub for over here in the corner. I am at Ashley's in Kansas. Ashley's one of my team, community manager, and she's training to be a postpartum doula. And she asked me to be here for her birth. So that's why I'm here, looking a little rough right now. Anyway, all right, you guys, I love you guys. If you have any questions, let me answer that for Angel real quick. Do they have to have male doctors during my birth if I only want female? They do not. You can tell them that you do not want male doctors in your room. You can insist on that. The only exception would be, let's say there's an emergency and an emergency physician, say a neonatologist for the baby comes in and only a male is on. That might be the exception. But yes, you guys have every right. We do that for religious purposes. We can do this for SA purposes. Since I'm pregnant as a result of SA, what do I say when they ask who the father is? I would tell them the truth, Angel. I would tell your provider and your nurse. No one else needs to ask. So, and you do not need to list them on the birth certificate. You can write unknown. That's what I would do. I'm so sorry, Angel, like so sorry. And I'm so proud of you for navigating this. Like, I can't imagine what you're going through. And we're here for you. You can reach out at any time. Okay, you guys, I love you guys so much. Be on the lookout for Ashley's birth and what's going on here. We're going to go do some curb walking and get that baby out. She's going to the appointment. She's going to her appointment, and then we're going to get busy. All right, Ashley, you watching this? All right, you guys, I love y'all, and I hope you have an amazing day. If you're one of my new students, welcome. I'm so happy. Oh, thank you. I saw someone say thank you for this, Trish. You're welcome. This is needed. All right, make sure if you're on YouTube, you hit subscribe. And if you're on Instagram, hit follow. If you're on TikTok, hit follow. Wherever you are, hit follow. Come and hang out with us.